Okay, so my topic of choice that was given voluntarily to me is septic shock. So the pathophysiology is usually some sort of site of infection. If it's on the skin, it's usually something you can see. It's red, it's warm, it might be pussing, might be bleeding. Typically that wound's been there for a while when you get to your patient, and it may or may not have a very bad smell. In my case, for this video, the purpose I'm going to use, my grandmother has a history of UTIs. So typically, whenever she gets septic, it's secondary to her UTI that we just didn't pick up on for a while until it was a problem. What's the first thing on that computer, Mom? It's pathophysiology and something else.
Potential causes.
Potential
signs
causes.
and symptoms.
There we go. Potential causes. So there's a lot of causes that can get to septic shock. It kind of just depends on the age of the patient and what's occurred. So for UTIs, all it takes is for you to just not have drank enough water, or for you to have, if you wear Depends or some sort of poise, if you urinate in those and you don't know about it, and the bacteria sits there a long while, it can backtrack into things. For skin issues, it's as simple as you didn't know you had an injury and it sat there for far too long, permeating in its own germs from what's already on the outside of the skin or on something else that you've touched. It can be as simple as you ingested something and your body didn't like it and it's held on to it for whatever reason. You weren't able to have a bowel movement or throw it up or whatever the case may be. There's a lot of causes that can get septic-y. Typically in younger patients, like middle-aged teens to like 30s, we're able to kick a lot of things and everything's fine. Babies and elderlies, not so much. They tend to hold on to those things and just keep them, and then you have to intervene with antibiotics and cleaning wounds and things that take a lot of time. So signs and symptoms kind of vary. Your big key point for any sort of septic thing is a fever. 9 times out of 10 you will have a fever unless you've caught it early, but you usually have a fever. Along with that, when you get to septic shock, you end up with things like hypotension. In the elderly, it's confusion, diaphoretic, just really dehydrated. They look sick when you get to them. And if they have an external wound, or even with UTIs, there's a smell. Specifically with UTIs, it's a very strong odor smell. If you can get to your patient and they have a catheter bag of some reason, or you're able to see the last time they've peed, it's usually a dark, thick, cloudy, gross kind of urine, and that leads you to suspect a UTI. And in the elderly, if they have a UTI and it's been prolonged, there will be confusion that comes with it, which means when you ask them questions like, what's going on today? Have you been sick? How old are you? They may or may not be able to tell you. In my grandmother's case, typically when she gets a bad UTI that gets septic shocky, she looks like she's having a stroke. Her left side droops, she's got left side weakness, she ping pong balls because she's got a wide gait walk, and she can't remember a whole lot of things. She can tell you she doesn't feel right and that something is wrong, but she can't tell you what it is. Oops, I might embarrass my grandmother. Anyway, so signs and symptoms, that's kind of thing. What's the other key point, Mom? I'm missing something. Hold on.
Is that
Uno woman.
Have you got Jolene over there?
No, Nana.
No.
There you go.
Where is she?
With Daddy.
She's with Daddy.
Oh.
Assessment and treatment.
Assessment. Okay, so if I was going to assess my Nana, her baseline is a slight confusion some days and some days not. So it kind of just depends. So I would ask her things like, hey, Nana, can you tell me what your name is?
Vera Tao.
Can you tell me when your birthday is?
April the 20th, 1934.
Hey, that's good. That's better than most days. Can you tell me who I am?
Tell who you are?
Mm-hmm.
Yeah, you're Danny.
Sweet.
You're my niece.
Your niece?
Yeah. You my daughter.
I'm your daughter?
Yeah.
Well, which one is it? I can't be both.
Well, if I'm your daughter, what is Danielle to you? If Danielle is my daughter, who is she for you?
Well, Danielle is your daughter.
Mhm.
Right. So that makes her your
Grandmother.
granddaughter.
She's getting there.
Yeah.
We got it. And what is your favorite drink, Nana, of all time?
A drink?
Mm-hmm.
I don't know, really.
Yes, you do. What do you ask me for every day?
Coffee.
There it is. So today, Nana's doing quite well because I know what her baseline is and I'm comfortable with it. Now, if I would have asked her who I was and she told me I was Laura or I was Faye, which is other family members, I'd know we're a little bit off of our rocker. Now, when Nana gets a UTI and usually I'm up on her and I'm with her, I know because I can smell it. It's, you know, you get that very pungent urine smell and it happens. So at that point, if I was her medic and she was my patient, I would go ahead and start an IV with some fluids because the best thing I can do for her right now is try to help her flush her system with fluids. I don't have antibiotics on the truck, so I can't give her that, but I can continue. I can give her Tylenol for her fever since she will more than likely have one, and every time I've ever seen her with a UTI, she in fact does have one. And we would transport to a facility where someone would then take care from me. I would keep up with her heart rate, making sure that she's not getting symptomatic tachycardia. Nana typically has AFib, so because I know that and I will see that, I'll be relatively all right with that because I know that that's her baseline and she functions that way. If I see AFib in a patient that their family members can tell me that's not normal, as long as they're not symptomatic, I'm not going to get too crazy about treatments for it. That's essentially what I would do, is mostly fluids and Tylenol and keep an eye out and keep monitoring. If anything changes or gets fishy, I would reassess and treat whatever it is.